Okay, in this video demonstration, we will be reviewing the corrective exercise program for arms fall forward impairment. So the first exercises are going to be the foam roll exercises. And this one is going to be for the latissimus dorsi, or the lat muscles. So Theo's going to demonstrate how to foam roll that. He's going to pick his body up, work his way up the side, just looking for those tender spots. Key thing here is you're not going to go into your armpit. A lot of blood vessels and nerves in there. They can get injured, and obviously we don't want that. So just be wary of that. Avoid the armpit. You're just going to go up your side and not fall over like Theo's doing. Okay. So next we're going to do the thoracic spine. So we're just going to work your way up. The upper back area. Belly's in tight to protect your back. And again, looking for any tender spots. If you hit a tender spot, just hold for 30 to 45 seconds. Perfect. Now we're going to move on to the static stretches. So Theo's going to show us the latissimus dorsi static stretch, also called the prayer stretch sometimes. He's going to go over to our table. Thumbs are in the up position, rounding the back, and he's just going to let his head drop to where he's getting a stretch in the sides of his upper back, the lat muscles. We're going to hold for 30 to 45 seconds. No bouncing, just a nice static stretch. The pectoralis muscle stretch, so the chest muscles, we're going to go over here and demonstrate just how much of a mess this gym really is. Theo's going to go to the doorway. Let me see if I can zoom in here. There we go. Stepping in, belly's in tight, stretching the chest muscles. Holding for 30 to 45 seconds, no bouncing. Perfect. Okay, now we're going to come back over here. Isolated strengthening exercises. So the first one, Theo's going to grab the bands again and show you how to do a row. Got that foam roll right behind you, buddy. I just don't want to see you trip over it. All right, so Theo's going to bend his knees. He's going to pull his stomach in tight, chest high, and he's just going to perform a rowing exercise. Pulling from the elbows, so to speak. So he's not recruiting too much bicep, pinching the shoulder blades together, keeping the shoulders down, stomach in tight, come back, hold. I like to say you have a walnut between your shoulder blades, come back, crush that walnut for a second, and then come back out. Okay, next exercise are the TheraBand T's, but Theo's he's not gonna use resistance, he's gonna step over here and show us how to do these. There's two versions I'd like you to work on to hit the muscles differently. Okay, so Theo's got his thumbs pointing towards each other, stomach's in tight, chest heights, and pinch his shoulder blades together, hold for a second, and come back out to that position. Perfect. So he's going to do 10 like that with the thumbs facing each other. Squeeze, hold, and then come back in. Now he's going to actually flip the thumbs over and do the same exact thing. Pinch, hold, and come back in. Belly's in tight, knees are bent, chest high. Hoorah! Power up. Perfect. Again, you can use the TheraBand in your hands for resistance, but for now that should work. Then he's going to grab the TheraBand and the towel. We're going to do a little rotator cuff strengthening exercises, internal and external rotation. You're going to roll that up a little bit more if you can, Theo, because we want to have a 30 to 45 degree angle at the shoulder if possible, just a little safer for the rotator cuff muscles. Shoulders are back and down, okay? Stomach's in tight, knees are bent. And what Theo's going to do with this one is just rotate, pull the band towards his belly button. He's going to come back to the neutral position right there. No farther than that. Pull towards the belly, hold, come back out. Just like that. Then he's going to switch. We're going to show you in the other arm how to do the external rotation. Same arc of motion, but now the resistance is in the opposite direction. Again, shoulders are back and down, chest is high, knees are bent, stomach's in tight, power up. So he's not going to go out too far. He's going to go from the belly button to right about neutral there. Belly button to neutral. Boom. Perfect. And the last of the isolated strengthening exercises, Theo's going to come out here and show us scaption. Yep, so he's not coming straight out to the front. He's not coming right out to the side. He's halfway between those two. There you go. Shoulders are back and down, maintaining that position. Chest is high, stomach's in tight, knees are bent. Here we go. So he's going to go from, I say, pocket to shoulder. Pocket height, shoulder. Boom, just like that. Again, he's not using any resistance. You can always add a couple pounds. If you're at home, you can use a couple cans of soup. We're looking to activate muscles. We're not looking to overload them. Perfect. And then we do 15 repetitions of those. Last but not least, we're gonna take all of these exercises, these stretching exercises, these activation exercises, and we're gonna bring them into one functional exercise, in this case, the squat to row. So again, neurologically, we're trying to realign everything and trying to get the brain to fire the muscles in an appropriate sequence. So Theo's gonna do a squat, chest high, stomach in tight. He's gonna come down into a squat. As he comes out of it, he's gonna pull towards himself and do a row. He's gonna let the hands go out as he goes down. One full movement, up, pull in, out, go down, just like that. Squat to row. Get close to parallel with your thighs. Boom. Hinging at the hip, let the butt out. Stomach's in tight. Pinch those shoulder blades. Remember what I said about the walnut, right? We'll make them do one more. There we go. Boom. Excellent job, Theo. Thanks. And that concludes the exercises for the corrective exercise program for the arms fall forward impairment.